I think we've met here once again in 4 days to take some kind of update from our engagement last Friday. This engagement is basically aiming at filling in the gaps of our own information. And like I indicated on Friday, I posted that for this engagement, we must always be learning about this pandemic that is raging the world. So anytime we engage, we want to give you some kind of additional information, and you have more follow-up questions. The team here will be prepared to listen to you. There have been various speculations, and I'm also reading some of the speculations just like yourself. For our country statistics, I think currently you are aware that the website figure has shot up to 24 as of this morning, with 1 mortality. That mortality coming from Kumasi. And once again, let me remind you, as I indicated last Friday, my intention is not to talk about specifics or any individual, but to convey to you some additional knowledge or information that we have gathered about the disease generally. As it is with most pandemics, that happens in various pandemics, the effect of the disease will vary from individual to individual. Even as we are gathered in this room, assuming we all got, God forbid, the same dose of the viral infection, the way we exhibit the disease will vary among us. And the reason is simple. Because the virus comes into our system as an antigen, as a foreign body to confront our system. Depending on your body's defense systems or mechanisms, you'll be able to fight to repel the virus. And the level of fight that you put up against the virus will determine how severe or mild the disease can be with you. I hope I'm very clear on that. I think on that score, for what we are seeing as a picture from this illness, some are showing very mild symptoms. Some will come up with moderate presentation. Others will show a severe form of the disease. And then the tail end will be those who will come in critically ill, who will be needing a very highly upgraded kind of support. So this is the span of the disease that you could get. And the kind of ability for you, the individual, to fight the disease is dependent on your own system and your own constitutions. Firstly, it's to do with age. The aged, as you age, especially beyond 60, 70, your immune system, because the body has its own system of actually producing all the immune complements for the body. And that's as you age and your cells are beginning to weaken and your organs are beginning to weaken in their function, your body defense systems also begin to fall. That's why the aged is quite vulnerable when it comes to these pandemics or any such viral infection. The other major one is to do with people who have pre-existing diseases or conditions, because that also compromises the body's ability to fight foreign body or any incoming disease. Like if you have conditions like renal failure or kidney failure, diabetes, cancer, and especially in this particular case, a pre-existing respiratory condition. Because this disease, the major target which is actually leading to mortalities is the fact that it affects severely your respiratory function, your ability to breathe in and out. So if you have a pre-existing condition that has already compromised your respiration, then the likelihood that this disease can have a debilitating effect on you is quite high, and some other related conditions. So I want us to be very clear about these things. And some, as we go forward, God forbid that we get more and more mortalities, but that's the kind of pattern that we are most likely to see. And in fact, most of the countries that have reported mortalities, the trend has been very clear, especially in the example of Italy, where they've had even mortalities more than China. You can see that it is a very aged who have actually suffered most. So I think with this knowledge, I want to continue to admonish all of us to be very sincere, to be very straight, and to be very religious with all the teachings that has actually come with us in terms of hand washing. And when I say hand washing, I mean regular hand washing. Please, the fact that you may not have sanitizer, for me, it shouldn't be a very, very big deal. For if you have water, wash your hands as often as is possible for you to do, because water could be available as much as possible. Don't let us over-rely on sanitizers. In our teachings, we think that the hand washing and regular hand washing actually should supersede the use of sanitizers. And then we must also adhere strictly to the respiratory hygiene teachings that we have all come to know. That you must cover your mouth or your nose when you are coughing or you are sneezing, just so that you don't drop droplets into the air and far away from you, especially for people who may be in and around you, irrespective of the distance. And let us make sure that we immediately dispose of such tissues, either in our water closets or in a dustbin nearby. Very, very important. And please, let us continue to drink and drink well. It's important that we keep our mouth and our throat moist all the time, because if you happen to inhale some of the droplets for whatever reason, for the regular time that you are washing your throat and while you are washing your mouth, it gets the virus away from the area where it can easily enter into the respiratory tissues, and it can go down into your stomach. That also helps to also replenish your body's fluid system so that you don't get dehydrated. In fact, in the prevalence of most viral conditions, one key problem is dehydration. So you want to make sure that you prepare your body very well with a very well hydrated body. And then also, we've spoken about social distancing. In fact, that is very, very key. And this one, we should observe it everywhere we find ourselves. That's why you see the way we are arranged on this high table, and I'm also admonishing you to do the same. Whether it's in the house, at the workplace, in the market, as much as we could, we should socially distance ourselves and find a way to communicate. And let me add this one, because as we have been doing the teachings, one key thing that also helps you to boost your immune system is to do with the way we eat. Let us make sure that we are eating and eating well. I mean, it takes time for nutrition and what have you to actually build our body's system in terms of fighting disease. But let us eat and eat well. And at this point in time, we admonish you to take more fruits and more vegetables, in addition to some of the basic items that we take in Ghana. But make sure these things are very well cleaned. As you have said, you are already washing your hands. You are already using sanitizers. So the fruits and the things you are going to eat, make sure that they are very, very well washed. Okay, if possible, even with warm water before you take these in as a way of actually boosting your immune system. In fact, earlier this morning, we have had reports of some recalcitrant areas in the city, and people are following up. I will urge you, the media, to please follow through these things for us. We should all be security personnel in the terms of actually supporting the president and the nation on the measures that have been rolled out. Because people are congregating for religious reasons and for whatever reasons. The point is that you could adhere to what kind of measures to protect yourself. But the person who is coming nearest to you, you don't know where the person is coming from. You don't know what the person has contracted. And the reason why we must be each other's keeper and make sure that this kind of information and education that is ongoing, wherever we find ourselves, we will continue to admonish people to do the kind of thing that they are doing. Currently, as I speak, in Konfanachi, we have one patient admitted who is doing very well. But we also have about 3 patients whose samples were taken last night, and we are awaiting the results. Hopefully, I'm sure by now the results should be in, and then by the time we get back, we should appraise our figures and also the subsequent care for some of these patients. But so far, that's how I can report to you. In this pandemic, our critical watch must be on those who have respiratory diseases, and asthma is a very critical example. Since when they have the attack, they are thrown into very difficult and challenging respiratory episodes. We must keep an eye on them and probably escalate the way we care for them than before, because they already have difficulty in gaseous exchange of between oxygen and carbon dioxide. Their respiratory levels are already compromised, and we know the deleterious effects of the COVID-19 infection, where it also affects the respiratory tract and the lungs. So in this time, for anybody who gets an asthmatic attack, we must actually be prompt in instituting whatever interventions for them, especially in assisting them with their respiratory efforts to keep them alive. So asthmatics and people who have respiratory or chronic respiratory diseases, we must keep an eye on them and promptly report and get them some kind of support. But like I said, in all these cases, please report to the team. They will get to the spot or wherever they are, assist them, and try and indicate that once they did real hospital care, they will be appropriately transported for such care. Respectfully, I want the media to assist us to implore on all hospitals in the region, private hospitals, what have you, where they suspect a particular case. They should not just put the patient in an ambulance and transfer the patient to Konfanachi. They should use the region's system that has been established to foremost alert the regional director and his team, and even Konfanachi Hospital, before such a patient is moved. But we say so because we have a protocol for transporting such patients, and we have a protocol for receiving such patients even in Konfanachi. So it's very important, whether you are a private hospital, you are a district hospital, or from wherever, it's important that you report. Now, the same thing that goes to even cases that are suspected from homes. I hope the last Friday when we met, we educated you on this, that as much as possible, where you suspect, that patient should immediately self-quarantine to inform the system so that we can trigger our protocols to get that patient educated, prepared, and transported if they need be. Because as you are aware, even the president communicated to us the last time he spoke on the Saturday, that some of the patients are already being managed in their homes, where you have a proper isolation. There could be a system to take care of you. Because I think the key thing is isolation. The key thing is isolation, just so that we do not encumber our hospitals and our system unnecessarily. But if even we have to, it must be properly done. Because the way the patient is managed from those homes or the hospitals or the centers, and even the mode of transportation is very, very key. Since all the staff are at risk and the public is also at risk, it's very, very important that we foremost report some of these cases, get the proper system triggered, and we handle such patients. Thank you very much.
As you've all heard, the death came from Kumasi, and my condolences to the family. We will continue to work as a team to support the process. Over 100 people are at the moment on our contact list, and the health system is following them up. Some of them we are using telephones, some of them we go visit them and then take their temperatures, and then encourage them to report if they have any signs and symptoms. But the key is the risk communication. The risk communication is still an issue. Hand washing with soap and water is number one. But the minimum is 20 seconds. So please, it should come out. Because if you don't wash it for more than 20 seconds, it's likely that you may not get all the virus killed. So sometimes it's important that you take this message across. Not just hand washing with soap and water, but hand washing with soap and water. And the time is so important, minimum of what? 20 seconds. The use of sanitizer is as frequent as possible. But if you don't have it, we believe that the hand washing with soap and water can do more than relying on the sanitizers. Do not touch your face. It's so important. Do not touch your face. It's a habit, but we believe that it's one of the key areas that we need to focus on. Though it's difficult to do, but I believe that we should all learn to do that. We've talked more about handshaking. Don't shake hands. Don't hug. Don't say that you are going to hugging. Is also there. And then the social distancing is 2 meters apart. 2 meters apart is very, very important. 2 meters apart. If you don't have anything to do in town, please stay home. If you think you can use phone to transact business, it will be better to do that. The more you go out, the more likely that you contaminate yourself. For those of us who has been using lift, if you are using lift, make sure that not more than 3 people will be in a lift at a time. And then when you come out from the lift, you can use your hand sanitizer. If you can go by the staircase, it's better because that will help you even to exercise more. And also, we are talking about exercise and reducing stress. Because the lift can also pose what? A danger when you are using the lift. We've talked about the social gathering, and we thank the President for all the measures that he's taken. If you have cough, fever, difficulty in breathing, please report to healthcare facility. Let us report to healthcare facility. You don't have to call someone, but please call the rapid response team. It's so important. And as the CEO said, if you have any of these chronic diseases, then your immunity will be very low, and it's likely that when you get the infection, it will be very difficult to manage. Hypertension, diabetes, chronic obstructive pulmonary disease. Using the Trapatre issue as a test case. In fact, this is a person who has been sick at home. And everybody realized that from the signs and symptoms and from the travel history, this may be one of the conditions. So we were alerted, and then our team went there, and then we realized that that's the situation. But he was still refusing. But we can't put the public in any danger. For that reason, we had to call RESEC, the security agencies, to support us to convey him to the hospital. And truly, when we tested, he was positive. So you know that in situations like this, though human rights and other confidentiality issues are very important, but public health is also the key. So if you are not conforming to the public health principles, we'll have to apply all force. And we have the public health law to support us. You talk about the market fumigation. Actually, it's a routine thing that they do. For me, the COVID-19 is only enhancing what they usually do. Because for those of us who have worked with the Ministry of Local Government, the routine fumigation of markets are so important. But I believe that if they do it at this time, it will also enhance our effort towards fighting COVID-19. So principally what they are doing in Accra This morning I heard it from the Deputy Minister of Local Government. He said that the purpose is not for the COVID-19. It's a routine thing that they are doing, but this is going to enhance whatsoever processes or interventions that we've put in place as a country to address the COVID-19. You all know the importance of it. You are media people. So we are pleading that this is so serious. If we get anybody doing that, making prank calls, we'll have to report the person to security agencies to deal with him. Because this is not the time to joke at all. Those who are jokers, I think we will need to make sure that they face the law. So if you know that you don't have any case and you call us and we get there and there's no case, we'll have to give you to the security agencies to deal with you. And it's so important. We are not going to joke with it at all.